All right, well, one of the things that we are really excited about this morning is we have not one, not two, but three people on with us from Missoula Community Medical Center. First of all, we have Megan Condres, Director of Marketing and Community Relations. Dr. Stewart is on the line with us. Dr. Mike Stewart.
I am the medical staff president.
And Dr. Feist, he's the emergency medicine physician as well. So I want to say welcome to all three of you folks. Welcome to Talkback.
Thank you.
Thank you, Peter.
All right. Now, Megan, if you don't mind, I want to start with you because, first of all, I just want to say thank you. This is so important for you folks to get on with one of our mass media stations, radio, television, newspaper, that sort of thing. And because during this entire COVID crisis, with very few exceptions, the hospitals have been very, I don't want to say tight-lipped, but they've been very careful about the way they communicate with the public, and I'm sure there's obvious reasons for that. Can you share some of those for us?
Well, the biggest thing for us is we just really want to make sure that we are we're not making these decisions lightly. And so we want to make sure that we're protecting our staff, we're protecting our personal protective equipment, and that we're protecting the patients that do need to seek care when they come to community medical center or any of our physician clinics or our walk-in clinics.
All right. Now, during the COVID, I know that there are two hospitals in Missoula, and I'm sure you have pretty much similar reasons for when the COVID thing first came forward. I know one of the issues was that hospitals did not want to be overwhelmed with what could have been a huge number of patients coming to the hospitals. And is that why I'm sure all hospitals around the country did pretty similar things in kind of putting aside some other things so that they could prepare for COVID. Is that right, Megan?
That's correct. We weren't, we were watching, projections across the country and seeing what was happening, and, Seattle's not too far from us. So we wanted to make sure that we were being very conservative in the patients that and the procedures that we were taking. We also wanted to make sure that we could protect our staff. We had the right protocols in place, that we had the right personal protective equipment, because just like the rest of the country and even the world, we didn't know how this was going to impact our community.
Sure. Now, if you don't mind, I'll address this one to Dr. Stewart. Dr. Stewart, what are, and again, we'll just go through the basics here, what are the symptoms of COVID, and what, I realize it could be a very, very serious disease, so what are the progressions that disease can go through if not checked properly?
Certainly. Well, it's one of those things that has certainly been a work in progress with us learning as we go. Initially, the things we screened for predominantly were for headache and for a dry cough. But we have realized that over the past few weeks that there's a lot of other symptoms that go on. For one, there's some people that are totally asymptomatic, which makes us a challenge. That's why testing has become so important. And we're going to include a lot of testing before any of our surgeries get going. But also, there's other things that have come up. We've heard about loss of taste and smell. All of a sudden, the idea of potentially having body aches and pains, myalgias, sore throat, all of these other things are starting to come into play as well. And one of the things that we're realizing has been a problem is what's called silent hypoxia, and that some of these patients actually have a significantly diminished oxygen saturation, but they are asymptomatic until they reach a certain threshold. We are screening for all of these things. We've been trying to educate, as has the entire medical community across the country. And certainly throughout all this, keeping our social distancing, keeping aware of our symptoms, checking our temperature, and maintaining the same things we've been doing the past few weeks are extremely important.
Now, let me ask you this. I know a lot of folks who, go to the grocery store, they don't wear gloves, they don't wear a mask, that sort of thing. And it's almost as if they're a little bit cavalier, as this can never happen to me. So can any of you address that?
I can take that, Peter.
Go ahead, Dr. Feist. Please go ahead.
Yeah. So much like the common cold, which the coronavirus kind of is one of the main causes of, it can spread like influenza, the common cold, where you can come into contact with a surface that someone has coughed upon or touched with some oral secretions, or you could just walking close to somebody and then kind of breathing in the air around them. is that puts you at the possibility of contracting the coronavirus. And so it can manifest for over a few days where you don't feel any symptoms, and then all of a sudden, like Dr. Stewart was saying, you may develop a dry cough, a runny nose, sore throat, body aches. And it's hard to know, do you have the coronavirus? Is this influenza? Is it just a regular common cold or flu? Because not everybody is presenting with the same identical symptoms.
Nick Christensen right over there taking your phone call because we have one line open. And we do have Alan on the line that does have a question for you folks. So let's get Alan on. Alan, good morning. You're on with our guests. Go ahead. What's your question?
It's not really a question because I've already been handled it, but it's very much involves the situation and the people you're talking to.
Well, what is your point?
Okay, my point is, before this all started, I went to community hospitals throwing up. And I was really, really sick because I'm what they call chronic pneumonia. And because I'm now homeless, I lost my home a few years ago. I'm a veteran without insurance in Montana. But when I walked in there puking and everything, they actually ran me out of there. So I hitchhiked to Washington, went to the Seattle VA, and I got there the day the first patient died in Kirkland. So the VA, instead of giving me they gave me prescriptions for some powerful medicine that drove the sickness out of me that I have. Okay? But ever since then, I've been quarantined myself from everything and everybody. But I'm back in Montana, and I'm scared to death to go to either hospital, either community where my son is born and where I've had many operations, because the hospitals have changed, and the ER people are very racist against Native Americans.
Okay,
and
Alan,
I have a witness of that day.
Okay, Alan, I'm sorry. I'm going to let you go on that. I'm sorry. So, gentlemen and ladies, this obviously is an individual who's had some problems here. Anybody want to take that call?
Yeah, I'll take that. Alan, I'm sorry you had that bad experience at our hospital. We're working really hard to make sure that when people are coming in, that if they're having symptoms related to COVID or respiratory symptoms, we're trying to make sure that we put those patients in special rooms to kind of keep them separate from other patients that are experiencing that, because we can't tell from your symptoms if you could potentially have COVID or if you could have something else. We're working really hard to be safe with not only ourselves, making sure that we're not going to get sick and then possibly give the sickness back to you. And we're sorry that you had that bad experience. We want you to come in. If you are not feeling well, we want you to come into our hospital so that we can take care of you. This is a very scary, anxious time, and I want you and all the patients that are, going to be coming to our hospital to know that we're in this all together and that we're with you when you're having these symptoms. And I'm sorry if you had a bad experience. That's not, our expectation. We want to make sure that everybody comes in and has a good experience.
All right. Well, I appreciate that. We have a different Alan on the line. Go ahead, sir.
Yes, thank you. Can you hear me okay?
Yes, sir. Go right ahead.
Okay. What my concern or my question is about people building up an immunity to the virus. I believe, or I think, that people need to contact the virus so they can build up an immunity. It's like the flu. There's different numbers out there, but of the people that have passed by contacting the virus, 94% of those people were diabetic, obese, or had hypertension. So what is your take on the people contacting it to build up an immunity?
So what you're talking about is called herd immunity, right, Alan?
Right.
Okay, well, let him answer that. Thanks for the call. So, lady and gentlemen, go ahead.
So, Alan, this is a very pressing topic right now, and the World Health Organization just released a statement the other day is that they're not sure that if you do develop the antibodies or the immune protection to the virus, that you're going to be immune to it if you get exposed to it again, and that's possible that you could get sick again, somewhat maybe similar to how people can get the flu once and then they can get the flu again maybe the next year. Herd immunity, I believe it's, I don't know if it's Sweden or one of the northern Scandinavian countries. They believe that they're going to have herd immunity because they had a fairly decent amount of people that were exposed to it. But it sometimes takes up to 80 to 90% of a population to develop a herd immunity. So until there's a vaccine, it's still too early to tell if you had the COVID, you developed antibodies to it, that you're going to be protected from getting it again. We just don't know enough yet, because there has been cases initially back in China of people that had the virus, improved, got better, and then got sick again like a week or two after they had already improved.
All right. I'll tell you what, I want to ask this question about testing. So which one of you wanted to handle the question about adequate testing supplies, especially here in Missoula, Montana, in what we call kind of flyover country? So if you wouldn't mind handling that before we take our next break. And then we have Kathy on the line when we come back from the break. So go ahead.
Well, testing has been difficult throughout the country. Right now at the hospital, we're testing patients that fit kind of a more of a worrisome criteria, people that are immunosuppressed, greater than the age of 65, have a lot of these comorbidities like Alan was just talking about with the hypertension, the obesity, the diabetes. The testing is very important for a surveillance purpose, what they would call like epidemiology tracking. The testing, although can give people peace of mind, is that because we don't have a direct treatment, the clinical course is more dependent on the symptoms. Like Dr. Stewart was talking about earlier, one thing that we're seeing in the COVID-19 that isn't very common in others is this level of hypoxia, where people aren't getting the oxygen into their bloodstream. So many people are having mild symptoms. Some people have, more moderate symptoms, but it's these people that are having severe symptoms. Sometimes tests can be falsely negative. So a negative test on its own is reassuring, but if you're having clinical symptoms that are suggestive of COVID, we can't necessarily say with 100% certainty that it isn't COVID, and that we have to continue with like supportive treatment, oxygen if needed, bringing into the hospital if people need IV fluids. So testing is really important for a surveillance or tracking purpose, and I know that with the phasing in that Governor Bullock is doing, that's a big key so that we can monitor what's going on in the community to make sure that we don't have another spike where it's like we see an initial decrease in cases, and then as we open things back up, then all of a sudden the cases come back.
Nick Christensen right over there. I'm Peter Christian. Joining us on the phone, we have 3 lines full of folks from Community Medical Center. Really want to say, again, thank you to Megan Condras, Director of Marketing and Community Relations, Holly Nagel, Associate Chief Nursing Officer, Dr. Mike Stewart, Medical Staff President, and Dr. Aaron Feist, who's Emergency Medicine Physician. And Kathy is waiting on the line. Kathy, good morning. You're on with our guests. What's your question?
Good morning. Well, thank you for taking my call, and I want to thank the people at Community and State Pass and all the other health professionals and EMTs, all the people that are trying to keep us safe. My question is relating to people who have already had the virus before the testing was available. There's a lot of people reporting that they had the virus late December, early January. And wondering about antibody testing, is there any signs on the near horizon that might be able to test those of us that believe we have that virus and possibly could be either able to help get out and interact with people who have not had it, maybe run groceries, those sorts of things, and be safe with them, or possibly be able to use the blood plasmas for treatment. I've called several places here in town, and at this point, actually even through the state, they're telling us that unless you had the virus after the testing was available, they won't even look at your blood.
Wow.
So wondering if there is some sort of availability to test those that had it prior to the original testing of the virus.
Okay. Well, Kathy, thanks for your call. So our guests, please go ahead. You'd like to jump in on that.
Well, I think
Kathy,
the trouble, Kathy, this is Dr. Stewart. I think that the hard part about this is what we call serologic testing, looking for antibodies. It's something that's being looked at. There's different antibodies that they look at, including what we call IgM and IgG. We think if you have IgG, you probably have had a more long-term exposure and potentially might have some immunity. I think our biggest concern right now is we don't know whether this is complete immunity, whether it's partial. Would those antibodies potentially help other people? There's a lot of people donating plasma and a lot of research going on in that aspect as to whether those are things we can do to help people get over this acutely. I think in the long term, the other question we have is, does this really give us long-term immunity? And I think that is still an answer we don't have. Part of that is just the lack of time for this, but we're trying to figure that out and wanting to know. There may be some people that have been totally asymptomatic and have complete immunity, but we don't know that yet. Or there may be others that might be able to catch this several times. And there's concerns that we might have a huge resurgence come the fall, and that would be even in people that have been exposed. So I think that's a great thought process. I think that's where a lot of the research is going now, but we just don't have those answers at this point. The testing is becoming much more robust and available. We do not have a shortage of testing here in Missoula at this point. We were very, very concerned at the beginning that there was going to be a giant surge, and so we were very, very cautious about things. Our supplies have never been pushed to the edge. We've done a great job of flattening the curve in this region. So we're going to continue that and keep monitoring things. But those are the exact important questions that we're trying to figure out right now, but just don't have those answers yet.
Okay, let's get another call in. This is Dave. Dave, you're on with our guests. What's your question?
Yeah, good morning. My wife has a business in town, and she has an employee that she would really like to have come back to work, but their whole family is sick, and they've asked, they have some of the symptoms of COVID, but there's been some refusal to test them, and it's been real frustrating. I guess, she would like the employee to come back to work, and it seems like they're withholding testing of people just because they don't have them.
All right.
I was curious whether there's going to be some change there.
Dale, I'm going to leave you on the line and let them answer that. So go ahead.
Sure.
Who would like to handle that? Holly or Dr. Feist or what?
Yeah, this is Holly.
I know that in town they have a testing center that at least has been opened up briefly, and I'll let Holly talk about that more as she is our incident command coordinator for the hospital. But they were allowing people to call in and then discuss their symptoms over the phone, and then at that time, if testing was felt to be needed or appropriate, that they would set up a time for those people to come and get tested for that. And I don't know if that testing facility is still open.
It is, yes.
Or if Holly has the direct number for that, or we could hopefully maybe get you guys the number so that...
Well, we have it. It's 258-INFO, 258-4636. But Holly, go ahead.
I would just add to what Dr. Feist said. There's the testing center at the fairgrounds. They have asked that individuals call to be screened prior to coming to be tested. We also have our nurse referral line that can be called at 327-4770. They'll do symptom screening as well. There's the Focus Screening Center at North Reserve for individuals who are having symptoms and think that they need to be tested. And then I think there's at least one more in town. So there's a lot of options out there. I know that the clinics and the testing centers are using their best judgment to determine who should be tested. As Dr. Stewart mentioned a minute ago, there's not a shortage of tests, but we are still trying to be somewhat judicious in who we're testing so that we're not inundating the state lab with multiple tests. So I hope that her employee can get back to work soon and that her family...
Does that help you, Dave?
Yes, thank you.
All right, Dave. Thanks for the call, man. Appreciate it. Having a great show here, folks. It's a shame it's only an hour.
I know.
I just tell Rush, hey, Rush, take the day off. We're gonna
There you go.
we're gonna monopolize these poor folks for the next 3 or 4 hours. No, I'm just kidding. Our guests on the phone: Megan Condra, Director of Marketing and Community Relations at Community Medical Center. So folks, all from Community Medical Center. Dr. Mike Stewart, Medical Staff President. Holly Nagel, Associate Chief Nursing Officer, and Dr. Aaron Feist, Emergency Medicine Physician. Kathy is back with a follow-up question. Kathy, go ahead. What's your question?
Well, I'm calling back, Peter. Thank you for having them answer my question, but now I have another question.
Go ahead.
Regarding the antibodies again, with them not knowing very much about all this, is there some place or some agency or some list that they are accumulating names for those that, believe we've had the virus, so that then maybe they could test our blood and help develop some of the testing? Is there any use of any of our experience, our blood, our, having had that virus? Is there any way that they will use it for research then?
All right. Thanks, Kathy. Go ahead.
Kathy, stuff like that will typically be going on at university hospitals and then also at state labs or CDC national labs. I think right now the main concern was kind of weathering the storm and getting through the initial flood of patients, particularly that were going into New York and I guess initially in Seattle. And because this is novel and not enough is really known about it, and it was different, and it has been different than many other illnesses that we've seen, is that a lot of the initial focus has been taking care of the people and trying to figure out what are the best treatments, as we found that there's not very many medicines that we can give to try to, help people out, and it's a little bit more of something called supportive care, giving them oxygen if they need. I know that now as we're learning more, I think the clinical side is going to start working with the research side to try to find out how can we find the antibodies in the plasma, what can we do with that? And I know that the government is going to be pouring a lot of money into that research. So hopefully going forward, there will be new developments, but sometimes those developments are very slow, as you don't want to develop a vaccine, not have it tested, then start providing it to people and find out that people are getting sick from the vaccine or there are other unwanted reactions. So unfortunately, it is a slow process. But I know that the FDA wants to be very safe and careful because there has been companies that are trying to exploit the antibody testing, and that they're putting tests that aren't very accurate and aren't very good, and they're putting them on the market so they know they're trying to capitalize on people's fear and anxiety. So, as we, just I guess maybe the best thing to say is be patient. We have very smart people throughout the whole entire world working on this, trying to find a solution.
I will tell you that this has thrown, I know, at the very least, our country for a loop, because we expect people get sick, get a vaccine, get a shot, get well, on we go with our lives. But it sounds to me like that's not going to happen for a while. I know we're into phase 1 and eventually phase 2 and phase 3. Do you, as medical professionals, see what we might call normalcy returning to our lives anytime soon? So I'll throw that to Dr. Stewart.
Certainly. Boy, that is such a hard question, and does make you wonder what is going to be our normal. I think that for a while we're going to be living in a really unusual place, and we're going to start opening the door very, very slowly. We're going to need to see what that looks like, and we're going to need to be able to pivot if necessary. We're going to be looking at data and things, but are we going to get into great big, are we going to go to Grizzly Stadium and pack it in 26,000 of us for a Grizz game? That's a hard question to ask, and this fall may be different from a year from this fall. So I think that there's just so many unknowns, and until we start opening the door a little bit and seeing where this goes, there's a lot of unknowns. I think no matter what happens, there's going to be some people that will be uncomfortable going back to our old normalcy of not masking, not washing our hands as often, going to large places. So those are the big questions, and I think that it's going to be a very slow return to normal, and our normal may be a little bit different in the future.
Yeah. So you know that, as you know, you may not know this, but I'm the public address announcer at the Washington Grizzly Stadium for football games, and
Yeah.
I have been just itching to get back behind the microphone and you know, talking to 26,000 people inside Washington Grizzly Stadium. That is something that I realize it's a few months away yet, and so miracles can happen. But you have to prepare yourself for what might happen. Am I right about that?
Exactly right. And those are things that we are still trying to figure out. You can just tell that we all have different opinions on this, and there's not a whole lot of definitive knowledge as to where this is going to go. And you can just look at people's opinions, and we can see that some people think we're opening too fast, others think we should have opened already. So this is just going to be a slow process, a learning process. We want to be very cautious, and we'd rather err on the side of caution. But the end out normal in the long run, boy, that's going to be a tough one.
Now, I wanted to ask you, we're 1 minute before a break, if one of you, maybe Holly or Megan or any of you, I know that Ellen Leahy, the health officer, has been just absolutely pummeled, recently when she came out with tighter restrictions than what the governor recommended. So, do you folks stand behind Ellen and the difficult decisions that she has to make?
This is Holly. I definitely don't envy the difficult decisions that she has to make. I think she's doing what's in the best interest of the public at large, and those are difficult decisions anytime, but especially when they affect us on the just minute-to-minute basis that these are affecting us. I do think keeping social restrictions in place and keeping gatherings limited is a good thing. As we start to incrementally open things up, we want to make sure that we do it in a way that allows us to see what the impact is going to be, and it may take us a couple of weeks, since that seems to be the incubation period for this virus, to really know what those impacts are. And if we open it just completely up and just say go back to normal, then we could have a much larger tragedy on our hands than if we do it incrementally and in a thoughtful manner. So I definitely don't envy the decisions that she's making, but I think she's making them with the best interest of everyone in mind.
One very important point you need to know is if you're at work, if you're driving around, you don't have the opportunity to really pay as much attention to what we're talking about today as you'd like to. This is being recorded on our Facebook page, on our Facebook Live page. So you can sit down with your computer or your iPhone or whatever, your iPad, and you can turn it up real loud and listen to all these medical professionals with their advice. So go ahead and ask those questions that came over online.
Yeah, so there was one caller that wanted to know if you guys think that the virus has mutated, and is that why we're starting to see blood clots as sort of a symptom?
So Dr. Feist, go ahead.
I think Dr. Stewart was going to answer
Mike.
this.
Go ahead, Mike.
Thank you. This has been an interesting development and just recently come up. And as I'd mentioned before, there's a lot of things that we didn't realize at first. For instance, the silent lowering of your blood level of oxygen. But there has been some reports of blood clots occurring. Certainly in any chronically ill patient, we're always concerned about blood clots from their immobilization, not moving around, not having their muscular compression to keep the blood flowing to their veins. Certainly, they've noticed that in diabetics, there's a significantly increased risk of developing some type of blood clots, and there's been some debate as to whether people should start on low-dose baby aspirin. There's really not much research yet. They think that in an average person that gets COVID, that's not really an issue, but they are beginning to see that maybe there's a little bit of an inflammation of the lining of blood vessels, what they call endotheliitis. This is very new and has only been out for a couple of days, and as to whether that is truly related to a mutation or whether that actually is just a basic characteristic of the virus, we don't know at this point. One of the reasons we're concerned about a potential resurgence come in the fall is that, as with flu, as with cold, sometimes these viruses do mutate. Sometimes mutations are less lethal, and sometimes they're more. So that's one of those things to wait. But we're not sure whether this is a true effect, whether it's affecting mostly diabetics, other people with chronic disease, or whether it truly is a characteristic of the virus itself that it affects the lining of blood vessels. So that's something that's under intense research at this time.
Okay, Facebook question, Nick.
Yeah, Elena wants to know, what are the risks attached to using ventilators, short and long term?
Well, your body is an amazing thing. The way that we are able to obtain oxygen out of the air into our lungs is something that's well studied. But what happens when people start to lose that ability to get the oxygen in, that when we have to put a tube down into the airway called intubation and then put somebody onto a ventilator, we always want to make that as brief of an intervention as possible, because your body will make changes based off of the stress of that, because there's a lot of different physics that goes into making sure that the air has enough oxygen, that it's under enough pressure, and that the ventilation and the in and out of the ventilator itself kind of regulates that to the most natural way of breathing possible. The longer that you're on a ventilator, the more weak your body gets with the muscles that allow your chest to expand and your diaphragm to expand so that you can get the air in. It makes you weaker. So what's happened with COVID-19 is that they found out that people are on the ventilator longer than we would initially anticipate if we compare it to something like influenza, where it's like maybe somebody would be on a ventilator preferably less than 2 to 3 days. Some of the patients with COVID are having to be on ventilators prolonged into like 7 days, 10 days. The longer you're on that ventilator, the weaker your body becomes in its ability to expand your chest and expand that diaphragm. So short-term ventilator is obviously better than long-term being on the ventilator. And it's hard to get people off sometimes. So it's always a process of checking every day, making sure that people the muscles are strong enough, the rest of their body is well enough to help support that breathing.
All right, good answer. Now, I know Teresa's waiting on the line, but I know it's very important because one of the things that sparked this visit is the fact that you are going to be started making some baby steps, if you will, into reopening the hospital. So, Megan and Holly, I know, Holly, you wanted to comment about this.
Yeah, so we are in our planning phases now to really start reopening in small baby steps some of our elective procedures and surgeries. So we are working now to start rescheduling patients in kind of a tiered, stepwise fashion. We want to look at those who are at the lowest risk but have the highest need to get back in for surgeries. Obviously, we never stopped doing things that were threatening to life or limb. We've continued to do emergency surgeries and things that were urgent for that patient, whether it be something along the lines of needing a cancer diagnosis that would help facilitate treatment, or again, something that was life or limb emergency. But we'll start bringing back some of our elective surgeries. We'll start with things like routine orthopedic surgeries, some hysterectomies, some urology procedures. So we'll start that anticipated next Monday, and there'll just be additional processes that the patients are required to go through. We will test everybody before they have their surgery, and we'll also ask each of those patients to quarantine at home for 7 days. We want to make sure that they're as healthy as possible and that we're also not putting our staff at potential risk for contracting the disease, or the virus, rather. So exciting things coming as we start to try to reopen and get back to some semblance of normalcy.
You bet. I know folks are very appreciative of that. All right. I promise we get Teresa's call as soon as we got back. Teresa, you're on with our guests. What's your question?
Well, my question is, a lot of my family and my friends are asking, is the ED safe? Right now we can't even go to McDonald's and sit down. So what kind of reassurances should I give them to tell them that if they need health care, they should go in the ED and that is there a need to be afraid or isn't there?
All right. Thanks for the call. So go ahead. So Dr. Feist, I think that would be your bailiwick. Yeah.
So, Teresa, we're doing everything that we can to screen people before coming into the emergency department to make sure that we put them into appropriate rooms so that they're not kind of getting spread in between people that aren't having respiratory symptoms. Now, there are a lot of other things that are going on with people with the medical emergencies, like heart attacks and strokes, that we can't lose focus of all these other things. We don't want people to be afraid. We're doing the best that we can to keep things safe, and we have to take care of those emergencies that would be going on if this COVID wasn't currently causing so much fear and anxiety. I think it is 100% safe for people to come into the emergency department if they feel that they are having an emergent condition. It's much more dangerous and worrisome if they put off those symptoms and that they delay their treatment, as it can lead to more serious illness and long-term problems. We don't want you to put off emergencies. We can handle the capacity, and we're going to do everything that we can to make sure that people are not going to be exposed to COVID-19 and that they're not going to be, in a place of fear and anxiety.
Excellent. All right, Joe's on the line. Joe, good morning. You're on with our guests. What's your question, sir?
I heard an interview of a health professional from Italy who said that the majority of the cases in Italy were elderly people, probably in that 80-year-old range, and they each also, like 75% of those patients had statistically 2.6 other factors, health factors, like we've said before, diabetes, hypertension, things like this. So the problem of identifying the cause of death and getting these statistics, I heard last night on the radio that there's a problem in Pennsylvania. The coroner is critical of some of the reporting because they're using probable causes rather than actual, and you mentioned that there's problems with these tests of antibodies that aren't conclusive. Anyway, if you have any comments on those.
Okay, all right. Thanks for the call. So as far as cause of death, so let's jump in there. Dr. Stewart, Dr. Feist, what do you think?
I think the cause of death. Go ahead. Yeah, the cause of death in some of these cases, because there could be many things going on outside of just the respiratory problems, as people can go into kidney failure. There have been cases where people are also going into problems with their liver, and when you put that together with people's underlying, they call comorbidities, like the caller was saying about how some of these patients are older and they have coronary artery disease and diabetes, is that when there's all these multiple things going on, it can be hard to sometimes determine what the actual cause of the death was and what was adding to the most serious complications that the patient was having. I think they're trying to do the best job that they can to track, are these COVID deaths or are they not? There's also concern that there may have been some COVID tests, COVID positive patients before that March time when everything really started to take off. I don't know if Dr. Stewart wants to add anything.
Well, we only have about 3 minutes, so Mike, go ahead.
Well, I just think that this is so complicated. This is an interesting disease in that it creates a very complicated pneumonia. In addition to other things, Dr. Feist was saying it bumps our liver enzymes, causing kidney problems. Now we're talking about maybe irritating the lining of our blood vessels. But in addition to what the disease itself does, our body creates a really significant response to this. And some of the problems that we're seeing, particularly in the lungs, is almost an excessive immune response to this, which is causing tissue damage. And we see people that go from asymptomatic to needing, some ventilatory things very rapidly. So there's just so much to learn. Anything that you have that complicates it makes it that much more challenging. So, just like with other things, we see any disease, influenza, things like that, compounded significantly by these other comorbidities that Dr. Feist was talking about.
Okay, now, Megan, we have exactly 2 minutes left. So I'm going to turn it over to you, if you don't mind, and talk about communities' stance on getting reopening and helping folks, and contact information, things like that.
Well, right now, we just want to make sure that people know that anyone experiencing new or unusual symptoms or worsening symptoms, that they really need to come in and be seen. If it's a life-threatening condition, please call 911 or visit the nearest emergency room. We do not want people delaying their care. For those who have been putting elective surgeries on hold, so adult or pediatric orthopedic surgery, hysterectomies, urology, any of those items, please contact your medical provider or surgeon so that you can have a conversation with them about getting you rescheduled. Anyone experiencing symptoms or think that they need to be tested, the City County Health Department, you can certainly call them at 258-INFO to be screened. And if they think it's appropriate for you to be tested, there's no charge for that testing. You can also call our 24/7 nurse on call, 327-4770. That's also a free service to check your symptoms, and they can let you know if you need to go in and be seen. I guess the last thing that I'd like to say is I really do want to thank the Missoula community, everyone all the way down to the Bitterroot, all of western Montana, and all Montanans. Everybody has done an amazing job at really taking this seriously, physically distancing, washing their hands, and that's the reason that we're in this position. From the bottom of our hearts, we really do appreciate what everybody has done, and let's continue to do it and slowly reopen so that we can kind of lead the nation in this.
Well, Doctors Feist and Stewart and Holly and Megan, we deeply appreciate your time. I know you're terribly busy, and thank you for sharing all this information with our listeners.
Thank you, Peter.
Right.
Thank you, Peter.
You guys take care.